Welcome to today's webinar. My name is Bob Hanson. I'll be your webinar moderator for today. Today's webinar with EdgeWave and Osterman Research is how protecting email content protects HIPAA PHI. Just a quick agenda and some housekeeping notes before we get into Michael Osterman's presentation. We'll have the two presentations followed by a short Q&A period. As well, at the end, we'll announce our winner to the $200 gift certificate, so stay tuned for that. And just a note, we are recording today's session, so if you want to share the recording with one of your colleagues, or if you miss a part of it and want to go back and listen to it, you can as well. So quickly, our two speakers today are Michael Osterman. He's the founder and president of Osterman Research, and he's going to tell you more about Osterman Research in a moment. And our second presenter is Jörg Sieber. He's the product marketing manager from EdgeWave. And he'll present after Michael is finished, and at that time he'll also reacquaint you with EdgeWave. So at this time, I'd like to turn the presentation over to Michael Osterman. Michael?
Well, Bob, thank you very much, and Jörg, thank you for being here as well. We'd also like to thank our audience for attending today. Just a little bit about Osterman Research so that you know where we're coming from in this discussion. As Bob mentioned, we're an independent market research and consulting firm, very focused on the electronic communication space. So we look at basically things like archiving and security and encryption and content management and so forth. And we're heavily focused on any type of technology that helps people to communicate. And as we'll be discussing today, use of email in the healthcare industry is one of our critical areas of focus. We have a very strong emphasis on primary research that we conduct primarily with IT decision makers, although we also talk to end users and business decision makers as well. We were founded in 2001, and the company is based near Seattle, Washington. So let's get right into it. We all know that email is incredibly useful. We all use email on a regular basis. The average business user, for example, employs email about 2.5 hours a day to do some type of work, whether it's directly sending or receiving emails or looking for attachments, managing contacts, managing tasks, and so forth. But it's absolutely vital to the way that we work. Email is used much more than the telephone, much more than social media or real-time communications, and it really is the primary way that we communicate and that we send content back and forth. And email is just as vital in the healthcare industry. We found, for example, in a survey of individuals that more than half of people consider it important or very important to be able to communicate with their physician or their clinic or some other healthcare provider. They like to be able to set up appointments, ask questions, receive information from their providers and so forth. So it's absolutely vital that email work in a healthcare context. We also found that email is so important that 1 out of 11 patients would probably or definitely switch to a new physician or clinic if they couldn't communicate with that physician or clinic by email. So we find that email creates a lot of stickiness in the healthcare industry, that it allows people to communicate in a more effective way, and that people will actually switch providers in some cases if they can't use email effectively. So bottom line is that email can provide tremendous value in the healthcare industry, and it's something that all healthcare organizations should seriously consider. They should seriously consider how they use email, why they use email, and how they can use email to gain more patients and really to provide better customer service. The bottom line, though, is that, and one of the fundamental problems with email is that most email is sent as clear text. Most organizations don't encrypt email. Even in the healthcare industry, a lot of organizations don't yet encrypt email, at least for non-critical communications. And that creates the real problem that sensitive or confidential content of some kind could be intercepted by unauthorized parties. And as we'll get into here in just a moment, that can have very serious ramifications in the healthcare industry. You can get enormous fines, as we'll talk about in just a moment, loss of reputation as a healthcare provider, and then a variety of intangible consequences. Maybe people not wanting to do business with you, or you getting on some sort of a blacklist of some kind. So there are really a variety of consequences that can occur if you have even just a minor breach of data. And those breaches are becoming much more serious over time, as well as the consequences associated with them. HIPAA. That's one thing that it's a regulation that virtually every healthcare organization and by extension their business partners need to deal with. And HIPAA really addresses the use and the disclosure of an individual's health information. It's a law that's been on the books since 1996 and has recently been bolstered that really defines and limits the circumstances in which an individual's protected health information, or PHI, can be used or disclosed by covered entities. And it also states that covered entities, basically insurance companies and anybody else that deals with that information, must establish and implement policies and procedures to protect that PHI. And the penalties for violations are up to $25,000 in some cases, or in some egregious cases, up to $1.5 million, depending upon when the violations occurred. Also, an individual who knowingly obtains or discloses individually identifiable health information can actually face a criminal penalty of up to $50,000 and a year in prison. Also, there's a specification for encryption of health information that is communicated over any network for which the transmitter, the covered entity, the insurance company, the healthcare provider, what have you, cannot control access. It's also important to note that if an unencrypted email that contains PHI is sent across the internet, a violation of HIPAA might have already occurred, even if that email was not intercepted. So just the mere fact that the content is available for review by an internet service provider or some other third party can actually expose an organization to penalties under HIPAA. So the penalties for HIPAA are very serious and have to be taken very seriously by anybody that deals with PHI. Now, the HITECH Act, which was passed in 2009 as part of the stimulus package, the American Recovery and Reinvestment Act of 2009, really upped the ante on HIPAA. The reach of HIPAA has now been expanded to encompass the business partners of entities that were already covered by HIPAA, entities like pharmacies and healthcare providers and others. The new HIPAA now includes entities like attorneys, accounting firms, external billing companies, basically anybody that does business with a covered entity like a clinic, a physician, a pharmacy, what have you. And while those business associates were accountable to the covered entities with which they did business under the old HIPAA, these associates are now liable for governmental penalties under the new law. Now for the really serious part of all this, if you are subject to HIPAA requirements, one provision of the HITECH Act is that the proceeds from HIPAA civil penalties will now be given directly to the Office of Civil Rights Enforcement within the U.S. Department of Health and Human Services. What that means is that those who enforce HIPAA now actually have a direct financial incentive to levy the fines and to make them as large as they possibly can, since those fines go directly into the budget for OCRE. Now, again, that's not implying that there's going to be any wrongdoing or that they're going to artificially inflate fines, but now there's an incentive where there wasn't one before. Also, individuals and lawyers excuse me, can now collect fines for violations of the HIPAA security rule, which really dramatically increases the incentive to sue privately when data is breached. So it's become a very serious issue for anybody involved in the healthcare industry, not only the old covered entities like pharmacies and clinics and doctors, but now their attorneys and business partners and anybody they do business with. So the ramifications of this are very serious. And again, HITECH requires that the proceeds from the civil penalties go directly to the OCRE within the U.S. Department of Health and Human Services, and this private right of action, the individuals and attorneys that can now collect fines for violations of the HIPAA security rule, makes the ramifications of all this much more serious. So what constitutes a breach of data, a breach of PHI? Well, for example, if an email that contains PHI, linking maybe a social security number to a prescribed medication, is sent to the wrong email address, if that is sent unencrypted, that constitutes a breach of data. If you have an unencrypted email that was sent to a business partner, even if it was not intercepted by an unauthorized party, if it was sent unencrypted, that constitutes a breach. If a hacker gains access to a physician's computer system that contains PHI, their medical records, the record of patient medications and prescriptions and so forth, that also is a breach. If you lose a laptop that contains PHI and the content was not encrypted, or a USB stick or a backup tape, all of that constitutes a breach. However, and this is a big however, if the breached data was encrypted, that does not constitute a breach according to the HIPAA security rule. So it's absolutely vital that if you have anything, any email, any laptop, USB stick, backup tape, what have you, that has PHI on it, that it absolutely must be encrypted at all times to prevent this kind of breach and the ramifications from this happening. So in terms of real-world examples of these kinds of breaches, here are just a few examples. But for example, a former physician at the Geisinger Health System emailed PHI to his personal email account, didn't have any encryption on it. That constituted a breach. 85 staff members at Johns Hopkins received an email from the Applied Physics Laboratory with personal benefits information attached. Again, without encryption, that constitutes a breach. The Kern Medical Center had a 16-day malware attack that required it to temporarily disconnect all of its computers from the county network. UC San Francisco suffered a phishing scam that exposed the records of 610 individuals. So there are lots of different types of things that can constitute a breach. In the case of this physician, it might have been a good faith effort to be able to do work at home or to process records at home on his own time. But again, because it was emailed without encryption to a personal email account, that constituted a data breach. And just about every organization at some point is going to experience malware that could potentially breach PHI data. So all organizations have to make sure that this content is encrypted and to make sure that they don't suffer a data breach of some kind. So in terms of the penalties, if content is breached for whatever reason, all of the affected individuals must be notified. So if the doctor's network gets hacked, if there's a malware attack of some kind, if a backup tape is lost, what have you, if an email is sent to the wrong party, everybody that was affected by that breach has to be notified. Also, if more than 500 individuals in one state have their data breached, then you, as the breaching entity, the physician's clinic, what have you, have to notify a prominent media outlet, and you have to tell them what you did so that that can be broadcast to the world. Also, a patient breach of more than 500 records requires offender's identity be noted on the Health and Human Services website. So again, now your name is sort of posted like a wanted poster in the post office, if you will, that you accidentally breached data or that you violated HIPAA rules, and it's there for all the world to see. And also, as I noted earlier, the fines for violations can now reach as high as $1.5 million per calendar year for repeated or uncorrected violations. For example, an organization that continues not to encrypt its email. It can also be $250,000 for willful neglect. So again, some very serious consequences, not just the monetary penalties, but also the notification to the world that you don't have your house in order. So what should you do as a covered entity of some kind, whether you're the pharmacy or clinic that's directly dealing with PHI, or the attorney or the business partner of some kind that also deals with PHI in some capacity? Well, first and foremost, you have to pay close attention to the HIPAA security rule because it does impose several requirements. You absolutely also need to scan for malware to make sure that you're not going to have a breach of data that might occur through some sort of a virus or worm that somehow infects your network. You also need to record activity on all of the systems in your network that contain PHI. Whether it's a file server or desktop computer, what have you, you need to make sure you know what's going on with those systems. And then you need to encrypt all data that's in transit and at rest. Make absolutely certain that all of your emails, that all of your backup tapes and so forth are encrypted so that you don't potentially have a breach of PHI for whatever reason. And then you also need to be able to prevent users from forwarding email that contains PHI to their personal accounts. And again, most of that is not going to be malicious in any way. It's going to be employees who want to do work from home or just have access to their records in another location. But it's absolutely vital that you make sure all of that data is encrypted and that it's managed appropriately. Now, encryption, I can't underscore this enough. Encryption is absolutely vital. You need to encrypt any sensitive email, anything that contains PHI in any form, you need to make sure that that's encrypted. The problem, though, is that some encryption solutions are difficult to use for both the senders and recipients. Now, there are a number of good ones on the market that are easy to use, but there are some older solutions or some other solutions that are just not that easy to use, and people resist their use simply because it creates another barrier to sending communications. Also, some solutions impose additional requirements on IT, and in most organizations, particularly over the last few years because of budget cuts and lack of growth in the IT budget, you don't really want to impose something else on the IT department that they're going to have to manage. So bottom line is that solutions have to be easy to use for both senders and recipients, and they also have to be easy for IT to manage to make sure that you can have that free flow of information, and so that encryption doesn't create another barrier to what you're trying to do. So in summary, email is an incredibly valuable tool in the healthcare industry, but unencrypted email is vulnerable to interception. And if an email contains PHI and it's breached, there are some very serious consequences, financial and otherwise. And organizations that handle any sort of PHI, whether they're directly involved in the healthcare industry or just on the periphery, like a doctor or an attorney or benefits administrator, what have you, absolutely has to make sure that they prevent those breaches and that they have encryption in place that can protect against them. Okay, that concludes my part of the presentation. Here's our contact information. I'd like to turn it over to Jörg Sieber of EdgeWave. Jörg, the floor is yours.
Thank you very much, Bob, and that was a very good introduction and overview of how important HIPAA compliance is for healthcare providers. Before I go into my presentation, I actually want to give you a little bit more of some backup data. But let me introduce myself. My name is Jörg Sieber, and I'm Product Marketing Manager at EdgeWave. And in just a few minutes, I will give you a quick overview of what EdgeWave is all about. But let me give you a little bit more background on some data breaches and what we experience here in the healthcare industry. A recent survey of healthcare providers, approximately 100 of them, revealed that about 96% of healthcare providers reported at least one data breach during the last 2 years. The average number of data breaches for the last 2 years was about 4, and that increased significantly from the prior year, which was only 3 data breaches per 24-month period. So that is definitely on the rise in healthcare. And in the next slide, I would actually like to show you some examples of some fines that we have experienced in the healthcare industry. And you can see that the fines that HIPAA applies to healthcare providers apply to both large and small companies alike, and they go into the multi-million dollars, starting from several $100,000 per fine. Actually, in that same study that I just mentioned, they asked the healthcare providers what the average economic impact of a data breach is for them. And the result was actually a staggering $2.2 million US. In addition, those companies also were asked what the average lifetime value of a customer or of a patient was. And that value actually came out to $113,000. If you consider what Michael just said about healthcare providers needing to disclose data breaches to their customers and so on if there's a major data breach happening, and if only 20 or so customers or patients leave you as a customer, that means we're already facing $2.2 million in damages just right here. So what I'm here to say is bad news that HIPAA compliance is actually just a very small part of the puzzle. It is extremely important to be compliant because damages and fines are very high, but HIPAA compliance is just a small part of the puzzle. Encryption is mandated by HIPAA. The way any healthcare provider protects their electronic health records or other PHI is left up to each individual company. So there's basically some additional questions that we as healthcare providers need to ask. One of those questions is, how do we protect ourselves against accidental data sharing and data loss? In other words, how do we make sure that absolutely every sensitive email that is going out there that's containing PHI is encrypted? How can we ensure that all of the sensitive data is delivered securely to the intended recipient and doesn't get intersected? Another question we need to ask ourselves is, how do we protect ourselves against malware infections? Very often phishing emails or other malware that infiltrates your network is after finding sensitive information. And someone is after that data. It doesn't have to be through an outgoing email or something like this. It could be as simple as a malware infection. And then finally, Michael mentioned that also, with the increasing workforce working from home, it becomes very important to ask ourselves the question, how do you protect yourself against data loss of data from mobile devices? So with the increased use of mobile devices from home or from like just traveling, how do you ensure secure data handling from remote users is actually applied? All of these questions fall into the category of best practices and not necessarily HIPAA compliance. And so they need to be asked to ensure your company is truly secure and not just compliant. With that said, I would like to just introduce you to EdgeWave. We are basically a comprehensive web and email security company that specializes in healthcare and other industry, and we are working with organizations of all sizes. What does this mean for healthcare? Well, we secure content that is communicated between you and your organization and anyone outside, whether they are patients, whether they are customers, insurance companies, partners, or vendors, or pharmacies. Anything, any communication that is coming from your company to the outside world, we are dealing with security in this issue. In addition to content management, we also protect the organization against accidental or malicious data loss. As we will find out in just a few minutes, accidental data loss is actually the majority of all data loss and data breaches that occur in any industry. EdgeWave basically focuses on data protection, data retention, and employee productivity. We have in the past and currently also been recognized by many industry analysts and publications for our product quality, for innovation, and for our vision. So, with this quick overview of EdgeWave, I actually want to go into one part of this presentation that talks a little bit about how we lose content. And let's take a look at the office environment, typical office environment, healthcare provider or something like this, some administrator sitting here and so on. Employees are constantly sharing information, and the methods in which we're sharing information are basically constantly expanding. The news are full of horror stories, what can happen with sensitive data and so on. Majority of data loss is unintentional, and this is the focus of this slide here. In a recent study, about 41% of data breaches happen because of unintentional use of an employee. Now that number has decreased significantly over the last few years, and that's mainly due to better employee education, that's due to employees being more aware of their actions and so on, but it's still a significant portion of data breaches that happen as a result of unintentional data use. Let's take a look at email, for example. The average employee sends about 44 emails per day. I don't know about you, but to me that doesn't sound too much actually. A company with 500 employees sends, according to that, 5.2 million emails per year. With that amount of data that we email every day and every year, something is bound to go wrong. All it takes is one click on a phishing email, another click on an email containing malware or bots, and you can valuable data. If we take a look at social media, for example, Facebook is used by 31% of users in medium-sized companies. Twitter is used by 23% of users in mid-sized companies. Skype is being used by 33% of users, and other instant message services are being used by about 58% of all of those organizations. So the use of these social media sites is increasing significantly, and it's increasing your chances of actually incurring a data breach just this way, by someone working from home through Facebook or through Skype sending sensitive data through one of these methods to a colleague or something, and it gets intercepted. Another thing we need to look at is web usage. So one of your users browses the website and hits a phishing site. That phishing site is after sensitive data, and it is not covered by HIPAA. It is a best practices issue that we're facing here. All right, this guy that is hosting this phishing site is after your sensitive data, and it puts you at risk. Another user in your office clicks on a link in a spear phishing email from that looks like it's coming from your HR department. But again, this sender, the actual sender of this email, is after some very sensitive data that you don't really want to share with the outside world. And finally, we also have bot infections. I just want to quickly spend a minute on what a bot actually does. A bot is a piece of malware that gets sent to your system, and it can sit in your computer system or on your hard drive for an extended period of time. It can record what's going on your hard drive. It can record your keystrokes. It can record all kinds of things, or it just looks for some kind of like email addresses, credit card numbers. And that bot, once it's on your network, it activates itself and it phones and calls with that information back to the bot herder, to the sender of that bot. So very nasty little critters that can cause an enormous amount of damage in your business. So what can we do as healthcare providers, or what can we do as any business out there basically to stop that kind of accidental data loss and that kind of risk? Well, any protection against email threats has three key elements in it: define, detect, and enforce. If we take a look at define, that means we're defining the rules. This is where an acceptable use policy is being developed and implemented. This is where you define what data you need to have protected, what kind of words, what kind of content, what kind of behavior we're looking for in an email that will stop an email from going through, from being sent to the wrong person, or from simply being sent unencrypted. Second of all, we have detection of threats. So this is where your detection engine comes in. Threats need to be detected for inbound and outbound emails. We have just seen the inbound threats with malware and botnets, but we have the outbound threats as well. So incoming emails will get filtered with the lowest possible false positives to avoid infiltration of malware, phishing scams, and so on. But outgoing emails need to get filtered to protect against accidental data loss. For example, ensuring secure sharing of sensitive data and stop data transmissions from bots and other malware. And then finally, we have the enforcement part of email protection. This means we need to have a very smart disposition tool at our availability of those emails that trigger alerts, such as, for example, an email that's containing malware, phishing scams. That needs to be discarded before it even hits your network. An outgoing email that's containing sensitive data should at the very least be sent encrypted, if not even stopped. Some emails contain data that should not be sent at all, and that should be stopped before it even gets into the outbox. Enforcement of rules should happen automatically and obviously as seamlessly as possible, without interrupting the workflow or adding unnecessary steps to the communication process. Implementing a solution that will incorporate all three of these elements in the most thorough way will protect your company against inbound and outbound threats on the email side. So with that said, let's take a look at what EdgeWave can actually offer you in terms of email protection, how we protect your healthcare provider, your company, from inbound and outbound threats. The cornerstone of our entire email security service is our email filtering, or EMF service. Here we actually offer inbound email security filtering and outbound email security filtering. We basically at this level scan for spam, viruses, and malware. So we protect your reputation by blocking outbound spam, and we're protecting your company from any infiltration of malware. So let's assume that the email filtering is the cornerstone of our entire messaging security suite. Now we need to add on top of this our DLP, our data loss protection package. DLP basically scans your outgoing emails for any sensitive data, and it doesn't scan just the emails, but it scans all attachments. Sensitive data like PHI could be patient records, it could be social security numbers, credit card numbers, all those kind of things. So the DLP engine scans anything that is leaving your company and inspects the contents of mail and attachments. So here in this DLP engine, we actually have HIPAA lexicons, HIPAA dictionaries. We also have PCI dictionaries included in here for credit card information. So it is scanning for all the sensitive data. Now the DLP engine detects this, and it actually has a built-in encryption trigger. So we can actually now add on top of this our encryption service, and both of those services work hand in hand. So encryption will now use this sensitive data and actually track the email delivery from end to end. Messages get delivered via a secure session web page. There's no custom software required by the sender or the receiver, and our encryption service works with any MTA, mail transfer agent. We have two additional services that EdgeWave offers. They're not necessarily part of the healthcare protection here, but I still quickly want to introduce them to you. One is our email continuity service. That means you're protecting your email access and email usability in case of a disaster, in case of a planned outage or something like this. If a disaster happens, your company will continue to have email access and actually can send outgoing emails easily through a web mail portal that is transparent to the end user. And then finally, our fifth part of the messaging security suite is our archiving solution, and that actually stores all emails in a secured hosted archiving service in an unalterable form, and is basically offers you easy access to old emails in case of e-discovery scenarios and so on. That is our email security suite. I do want to spend a little bit more time in describing our encryption service to you, since this is the key component of being HIPAA compliant. So how does our encryption service actually work at EdgeWave? Good question. That means we are actually using what is called park and pull encryption. A sender sends an email message, all right, so let's assume one of your employees is sending an email message. Our DLP engine designates this or determines that there is some sensitive data in here, so it gets encrypted. The encrypted message is now being sent to a secure message portal, and it gets parked in a mailbox. The message portal then notifies the intended recipient of the email with a message that says, hey, this and this person sent you an email, it is a secure message, go to this and this portal and pick up your message. The recipient now goes to the portal, logs in. If it's the first time, he creates a username and a password. If he already has an account, then he just logs in, accesses the email, and can read it, send it, forward it, download it, whatever he needs to do over HTTPS. So the nice thing about this type of encryption in a healthcare and in a consumer-facing world is there is no need for any software. There's no need for any key exchange. It is a very simple-to-use encryption method that basically gives you full compliance, and it is easy to use and not as complicated as, for example, an end-to-end encryption where you have key exchange and software downloads on both sides. This is the reason why I wanted to share this with you real quick. It's a very simple encryption method that EdgeWave is using. Now, if we, oops, got stuck here. I already mentioned that email security, outbound email security is very important, encryption is very important, but you cannot be completely secure without internet protection and web protection. And here is basically, we have to look at a very similar scenario, a very similar picture that we just looked at on the email side. Again, we need to deploy a mechanism that actually protects us against malware infections, botnet infections, phishing sites, and other sites that have bad reputation. And the way we protect it is very, very similar to email protection by defining the rules of the game, by detecting the threats, and by enforcing these threats. EdgeWave offers a very well-known and very reliant and reputable web filter out there, and it's called iPrism. And I would to quickly introduce you to our iPrism security suite as well. On one hand, we actually offer complete protection on premises for any web filtering, any web access that's happening in your company. So we enforce web acceptable use policies in one appliance. We have transparent bridge or proxy deployments. So we are basically completely securing your company from bad malicious websites. But what's happening more and more in the world is remote users and mobile users are accessing the internet on either their own devices and bringing those devices into work, or they're accessing the web on company-owned devices. And EdgeWave, with our iPrism security suite, we actually offer complete protection for remote and mobile users as well. So the threat of accessing phishing and malware sites, the threat of botnets and so on, is just basically significantly reduced. I do not want to say eliminated, but it's completely reduced to a level that is basically keeping your company very, very secure. And so basically at the end of this presentation, I want to leave you with 5 steps to avoiding data loss. And the first 2 steps are relatively close together. First of all, we need to establish a clear acceptable use policy. And second of all, we need to train our staff and employees on acceptable use policy. As we have seen in a few slides ago, in unintended data breaches are actually on the decrease, and that is mainly due to companies getting smart about establishing clear acceptable use policies and training employees. So employee awareness goes a very long way to decreasing unintended data loss. We also need to monitor outgoing email and attachments for sensitive data, such as HIPAA words, HIPAA terms, with DLP. We also need to ensure secure delivery with encryption. And finally, we need to monitor and stop phishing sites and bot activity with good web security technology. So, again, when we talk about HIPAA compliance, we're basically talking about encryption. But in order to get your company completely secure, we need to take it one step further, and we really need to not just talk about encryption, we need to talk about complete email and web security, which can be achieved with good web filters and a very good email security suite. This basically completes my presentation. I want to announce to you real quick that EdgeWave just recently was named the SC Magazine Innovator of 2011. And we were basically receiving this recognition not only for our current range of products, but for the innovative direction in which the company is moving. That means we have gotten this award because we are actually recognizing the need to have an integrated web and email security suite out there, and we're working in that direction. One thing that I would like to offer to all the webinar attendees today is a free encryption trial. You can go to www.edgewave.com/encryption. That's again www.edgewave.com/encryption, and just simply complete the form out there, and one of our sales engineers will be in touch with you to set you up with a free encryption trial on our email security suite. With this, I would like to hand it back to Michael, who is, I think, going to open the floor up to some questions that may come from the audience.
Yes, absolutely. Jörg, thank you very much. A great presentation. Let's get right into the questions. First question, how do your DLP and encryption services work together? Could you give us a little more information on that?
Yeah, that's actually a very good question. The DLP and encryption really works together hand in hand. DLP is the data loss protection engine that has dictionaries and lexicons for HIPAA terms such as PHI, such as healthcare records, patient records, and so on that the engine is looking for. As soon as the DLP engine detects a sensitive piece of information in an outgoing email, it can trigger automatic encryption of that message and automatic encrypted message delivery. So that's how they work together. They're also being used on the same user interface, and they're basically the same hosted service. It's all part of one package with EdgeWave.
Okay, very good. And that leads right into another question we have. Are any of your email security services integrated?
Yes, they are. Actually, all the 5 services that I have shown you are integrated in one easy-to-use interface. They all work together. They are all fully hosted and a SaaS product, basically, for healthcare providers. So all of them use one interface. All of them are easy to manage and are basically hosted for you as the healthcare provider. So that basically decreases the amount of time and effort that you have to spend on managing those kind of services.
Okay, very good. And I do want to remind our audience that we will be drawing for a $200 American Express gift card at the end of this presentation, so to hang on. Next question. If HIPAA stipulates only encryption, why is it that I need any other services beyond that?
Yeah, I hear that question quite a bit actually, and it really goes back to the entire presentation. HIPAA is just one piece of the puzzle. HIPAA compliance is just one piece of the puzzle, I should say. HIPAA stipulates encryption, but encryption does not, just because you deploy encryption in your company, does not secure your company. If a data loss occurs outside of HIPAA, or outside of encryption, you are still liable in HIPAA terms, and you can still experience significant economic loss in your company. So complete security includes not just encryption, but includes web filtering, it includes email inbound, outbound filtering, it includes botnet protection, all those other services that I have mentioned. They're not stipulated by HIPAA, but they are just part of best practices for any healthcare provider.
Okay, very good. Next question. If I have encryption but I lose an email, am I still responsible for the loss?
The short answer to that is yes. It's true. If you send an email that is not encrypted, or if you lose PHI, any kind of credit card information, patient record through Facebook, instant messaging, or something like this, you are very, very much still liable for that data loss. So it's very important to control the social media use of your employees, even when they're accessing corporate networks from home.
Absolutely, and I just want to add to that too, that even what is seemingly innocuous type of data loss, like if a manager sends the external benefits administrator an email that says, "Hey, is Joe's Lipitor covered under our health plan?" That constitutes health information, because now you've associated a name with a medical condition or a medication, and so that constitutes a breach of PHI as well.
That's true. Yes.
Okay, another question. How do EdgeWave's email and web products work together?
Yes, that's a very good question. We are in the process of integrating the two services and the two products more and more. Currently, we are taking the first few steps on integrating both web and email security, and that you can actually see in iPrism side. We now offer email protocol blocking, whether it's MAP, IMAP, or HTTP emails or something like that. We're blocking those personal email uses on the iPrism side, and of course that works hand in hand with the email filtering service. We're also offering botnet protection in both products. So the iPrism eliminates botnet communication with the outside world, and the ePrism, the messaging security suite, the email security suite, stops any botnet from sending out malicious emails or sensitive data to the outside world as well. Also, both products actually have antivirus as well.
Okay, very good. That actually constitutes all the questions we have at this point. So Jorg, thank you very much. A great presentation and great content. And the winner of the $200 American Express gift card that we drew randomly from the attendees is Pedro Rivera. Pedro, we will be contacting you very shortly, and congratulations. Jorg, thank you once again. And Bob, I'd like to hand it back to you now.
Okay, on behalf of our audience, I'd like to thank Jorg and Michael for a great presentation and covering the questions. If you do have any questions that you did submit that we didn't have time for today, we will forward those on to the presenters. We hope you will join us at a webinar in the near future, and at this time we will end the webinar. Thank you very much.